Hello, I am Professor Dureja and I am the Clinic Director at the Delhi Pain Management Center. We are a group of daycare hospitals dedicated to the diagnosis, treatment and management of chronic pain. Before starting the Delhi Pain Management Center, I was working as a professor at the All India Institute of Medical Sciences for the last 20 years, ever since 1985. While working at the All India Institute of Medical Sciences, I realized that there was a huge void in the services provided to the patients who were suffering from chronic pain. And to fulfill this unmet need, I started the Delhi Pain Management Center in Safdarjung Enclave in the year 2005 and developed it to a world-class center of excellence for providing treatment and management of chronic pain. The vision of Delhi Pain Management Center is that everybody should lead a pain-free life. And for this, we are setting up centers across Delhi and NCR. And I can proudly say that during this period, we have been able to give a pain-free life to more than 70,000 patients, not only in India, but from across the globe. Pain clinics or pain management centers are healthcare facilities where all these aspects of pain management are available. When a person is looking for a management of pain in terms of chronic back pain or in terms of disc related pain or in terms of joint related pain, pain management centers can provide a holistic care of pain, and all these aspects are looked into. Pain management centers or pain clinics are ideal when we are looking at patients who want to avoid surgery, because here, with the convenience of non-surgical interventions like injections in the spine, you can certainly avoid the possibility of a surgery. The hospital stay is very little. Patient does not have to be admitted in the hospital. It is a daycare procedure. There is no need for general anesthesia. Patient does not experience a lot of pain and he can walk out of the clinic with pain-free periods. When we talk about pain medicine or pain management, we in Delhi Pain Management Center try to provide a holistic approach to management of pain. And when I say holistic, I mean all aspects of pain management, like medications, like physical therapy, like interventions, non-surgical interventions, and then the rehabilitation. And when we are able to provide all these services, we call it as a holistic pain management. And we, particularly in Delhi Pain Management Center, try to see that every pain condition, may it be a neuralgic pain, may it be a back pain or a joint pain or cancer pain, we are able to provide a complete care so that patient not only has a good relief in pain, but has a better quality of life.
Hi, I am Dr. Dhruv Bibra, working as a senior consultant at Delhi Pain Management Center. My journey in pain started around 10 years back. It has been challenging, tough, but equally satisfying. I have done my MBBS, DA, DNB and my fellowship from Escolab Academy, Germany. I am actively involved in the various researches and studies that are taking place in our center. I even got the opportunity to present my paper at the prestigious World Congress of Pain in Buenos Aires, Argentina and Yokohama, Japan. My special area of interest is disc-related pain, neuralgic pain and cancer pain. As we all know, WHO has given chronic pain the status of a disease rather than a symptom. It has been postulated in one of the studies that around 22% of the Indian population is suffering from chronic pain. More than 40% of absentees from workplace is because of chronic pain. It is the second most common cause after fever, common cold, for which a person seeks medical advice. And ironically, more than 50% of these patients turn up at general practitioners for their pain management. General practitioners, because they are not trained, they give them a simple set of painkillers over and over again without any significant relief, and on the contrary, decreasing their quality of life. Pain medicine is a holistic, multidisciplinary, multimodal pain management service in which we use pharmacotherapy or medicines, physiotherapy, exercise therapy, occupational therapy, psychotherapy, and most importantly, interventional therapy, which are a set of specialized injections in which we can deposit the highest concentration of the most potent drug at the pain generating structure to give us a adequate, long-lasting pain relief with minimal or no side effects. One of the most common types of pain that we encounter in a regular OPD is a neuralgic pain or a neuropathic pain, or in common terms, nerve-related pain. This occurs because of actual mechanical damage to the nerve or malfunctioning of the nerve. It manifests itself as tingling, numbness, pinprick sensation, and sometimes in severe case as a muscular weakness of that particular area. The most common type of neuralgia that comes across in our OPD is a trigeminal neuralgia. It occurs because of the malfunctioning of the trigeminal nerve. It manifests itself as electric sensation kind of a painful attacks in the distribution of the trigeminal nerve, which is the face. It can be managed effectively with a combination of pharmacotherapy or drugs. If the patient is not getting adequate pain relief, developing side effects, or wants a rapid pain relief, in those conditions, we can go for interventional or injection techniques in which we inject, bringing about chemical neurolysis of the trigeminal nerve. Along with that, we can also go for a radiofrequency ablation of the same nerve. Either of the two techniques can be decided based on the condition of the patient. Along with that, the other kind of common neuralgias that we come across are occipital neuralgia, intercostal neuralgia, scar neuralgia, ilioinguinal neuralgia, and other types. Along with that, certain medical conditions also manifest itself as neuralgias, most common being diabetes. आम जनता में पेन मेडिसिन को लेके कई गलत धारणाएं हैं, जैसे कि उनको लगता है कि एलोपैथिक पेन मेडिसिन सिर्फ कुछ पेन किलर्स पर ही निर्भर है, जबकि ऐसा नहीं है। इंजेक्शन लोगों को लगता है कि सिर्फ स्टेरॉइड के ही होते हैं, पर ऐसा नहीं है। जिस तरह साइंस और विज्ञान ने प्रगति करी है, उस तरह पेन मेडिसिन भी अब काफ़ी आगे निकल चुका है। आज की तारीख में हमारी नवीनतम टेक्नोलॉजी के द्वारा हम बहुत नए नए प्रकार के सेफ और इफेक्टिव इंजेक्शन ला पाए हैं, जैसे कि PRP इंजेक्शन और प्लेटलेट रिच प्लाज्मा इंजेक्शन, जो कि एक स्टेम सेल थेरेपी या रीजेनरेटिव थेरेपी का एक प्रकार का इंजेक्शन है, जिसके अंदर हम पेशेंट का खून लेकर ही उसके अंदर रेड सेल्स और प्लेटलेट रिच प्लाज्मा को अलग कर पाते हैं, और जहां पे डैमेज है, जहां से दर्द आ रहा है, उस पर उसको डिपॉजिट कर सकते हैं, जिससे कि बिना साइड इफेक्ट के पेशेंट को ना सिर्फ आराम मिलता है, बट जो डैमेज टिश्यू है उसका भी रिपेयर हो सकता है।
हेलो फ्रेंड्स, my name is Dr. Gaurav Channa. I am working as a consultant at Delhi Pain Management Center. I have been working here since last 2 years. Prior to coming to here, I was working in All India Institute of Medical Sciences and Guru Gobind Singh Hospital. I have done a post-graduation in anesthesiology, and I have also done a fellowship in pain management from Asclepius Academy and Delhi Pain Management Center. At Delhi Pain Management Center, we try to manage our patients very comprehensively and holistically. Most of the patients present to us with the complaints of musculoskeletal pain. One of the commonest musculoskeletal complaints is back pain. जब patients हमारे पास आते हैं back pain के साथ, mostly they are from either from a young age group or from a elderly age group. Young patients हमारे पास आते हैं जिनकी complaints होती हैं कि वो दिन भर ऑफिस में बैठे रहते हैं अपने लैपटॉप या डेस्कटॉप के सामने, और उनको complaints होती हैं कि at the end of the day they are severely affected by the pain and they are unable to carry out their daily activities. Sometimes the patient also presents with the complaints of back pain which is coming down the leg, जिसे हम commonly terms में sciatica और sciatic pain बोलते हैं, और इसके साथ उनके चलने में प्रॉब्लम होता है, उन्हें बैठने में प्रॉब्लम होता है, उनकी टांग सुन्न हो जाती है। ऐसे केसेस में यूजुअली कुछ इन्वेस्टिगेशंस के साथ हम उन्हें इंजेक्शंस के लिए तैयार करते हैं। इंजेक्शन से पहले दवाइयाँ ज़रूर दी जाती हैं। अगर दवाइयों से उस पेन को मैनेज किया जा सकता है तो हम दवाइयों के सहारे ही मैनेज करते हैं, नहीं तो कई बार हमें इंजेक्शंस का सहारा लेना पड़ता है। इंजेक्शंस ऐसे होते हैं जो कि आपकी स्पाइन में लगाए जाते हैं और एक मशीन जिसे हम फ्लोरोस्कोप कहते हैं उसकी गाइडेंस में लगाए जाते हैं। उससे हम पर्टिकुलर लेवल को टारगेट करते हैं और एक लोकल एनेस्थीसिया देने के बाद उन इंजेक्शंस को कंप्लीट किया जाता है, जो कि नॉर्मली आधे घंटे से पौने घंटे का प्रोसीजर होता है और उसके बाद 2-3 घंटे ऑब्जर्वेशन में रहने के बाद पेशेंट उसी दिन अपने घर जा सकते हैं। बैक पेन जिसका कारण एक स्लिप डिस्क भी हो सकता है। स्लिप डिस्क के लिए हम मोस्टली ओजोन न्यूक्लियोलाइसिस करते हैं अपने सेंटर्स पे। ओजोन मशीन के ज़रिए ओजोन और ऑक्सीजन का मिक्सचर बनाया जाता है जो कि एक इंसान की डिस्क में इंजेक्ट किया जाता है। वो भी प्रोसीजर एक फ्लोरोस्कोप की गाइडेंस में होता है। फ्लोरोस्कोप के नीचे पेशेंट लेटा होता है और उसमें एक लोकल एनेस्थीसिया देने के बाद ओजोन इंजेक्ट की जाती है। उससे पेशेंट्स के पेन में और डिस्क के साइज़ में दोनों में कमी आती है और पेशेंट्स जल्द ही अपने पैरों पे दोबारा खड़े हो पाते हैं। Delhi Pain Management Center has various centers across various parts of Delhi and NCR. Each and every center is equipped with a fully functional OT. In operation theatre, we have latest machines, fluoroscopes, PRP machine, ozone generators, and radio frequency machines to take care of your pain in a complete manner. Apart from root sleeve blocks, ozone nucleolysis, sacroiliac injections, piriformis injections, we have various types of advanced injections and techniques to take care of your complex spinal pain, such as spinal cord stimulators and morphine pumps, which can be inserted. We have the expertise and the equipment to take care of your pain.
Hello my friends, I am Dr. Siddharth Hora. I am working as a consultant in Delhi Pain Management Center. I have finished my post-graduation from the renowned Narayana Hrudayalaya Institute of Medical Science, Bengaluru, followed by I holds a couple of fellowships, including the fellowship in ultrasound guided regional blocks and pain management fellowship. I am working in Delhi Pain Management Center from last 1 year. In Delhi Pain Management Center, we treat all types of pains, out of which one of the most interesting and most common pain what we see is a joint pain. Joint pain can be of several types. It can be a knee pain, it can be a shoulder pain, it can be a back pain. Usually there are several causes of joint pains like rheumatoid arthritis, osteoarthritis, ankylosing spondylitis. It can be because of bursitis or maybe because of simple sprain also. So we treat all types of joint pain in Delhi Pain Management Center. So in mild to moderate joint pain, we usually provide the conservative management which can be with braces, with oral medications, with other home exercises. But in severe pain, we may require to inject potent anti-inflammatory intra-articular or injections in the joints, which relieves the patient's pain and inflammation. So जोड़ों का दर्द का इलाज कई तरह से किया जा सकता है. अगर जोड़ों में दर्द बहुत ज़्यादा है तो हम उसमें एक गाढ़ा लिक्विड इंजेक्ट कर सकते हैं, जिसको कि आम भाषा में ग्रीस बोला जाता है जोड़ों का. तो वो इंजेक्ट करने के बाद भी पेशेंट को काफ़ी फ़ायदा होता है. एक रीसेंट और अपडेट ट्रीटमेंट भी हम लोग उपलब्ध करवाते हैं, जिसको कि हम प्लेटलेट रिच प्लाज्मा बोलते हैं या पीआरपी थेरेपी बोलते हैं. इसमें पेशेंट का ब्लड लिया जाता है और उससे प्लेटलेट्स निकाले जाते हैं जो कि कॉन्सनट्रेटेड प्लेटलेट्स होते हैं, और उस प्लेटलेट को हम लोग सभी प्रकार के जहाँ भी प्रॉब्लम है, जहाँ भी सूजन है, उन जोड़ों में डालते हैं। तो उससे उनकी सूजन भी दूर होती है और एक परमानेंट हीलिंग भी होती है। तो वो एक नेचुरल रीजेनरेटिव प्रोसेस है जोड़ों के दर्द को ठीक करने का या जोड़ों की सूजन को ठीक करने का। उसके बाद उसमें से प्लेटलेट निकालते हैं और उस प्लेटलेट को सीधे जोड़ के अंदर इंजेक्ट करते हैं, जिससे कि धीरे धीरे हीलिंग प्रोसेस स्टार्ट होता है और रीजेनरेशन होता है और जोड़ों का सूजन भी कम होता है, साथ साथ उसका हीलिंग भी होता है। तो इस तरह से हम लोग सभी प्रकार के जोड़ों का दर्द का ट्रीटमेंट दिल्ली पेन मैनेजमेंट सेंटर में करते हैं। इसके अलावा पेशेंट्स को और फ़ायदा देने के लिए हम लोग एक्सरसाइजेस के वीडियोस भी भेजते हैं।
Hello, I am Dr. Kalpajit Datta, working as consultant in Delhi Pain Management Center. Prior to joining Delhi Pain Management Center, I was working in Pain and Palliative Care Department of All India Institute of Medical Sciences for 3 years. Then I did fellowship in pain management from Esphilip Academy, Germany. I worked in various type of pain like neuropathic pain and cancer pain, and I have lots of publications in various national and international journals. My area of interest in pain is complex cancer pain and back pain management and various joint related pain management through non-surgical interventions. There are various causes of pain in cancer. First, pain because of the diagnosis like biopsy test, bone marrow biopsy and spinal tapping. This all can cause pain. The second is the tumor itself. Sometimes the tumor of cancer, it can compress in nerve, bones and soft tissues, which can cause pain. Thirdly, sometimes the tumor which is located in the spine can compress the spinal cord. So in that case, the pain can even occur while sneezing, coughing, etc. Pain can also occur due to treatments like chemotherapy, radiotherapy and surgery. Treatment related pain can be of various types like neuropathic pain. Neuropathic pain can occur due to damage occurring to the nerves, and there is one terminology called phantom limb pain. Phantom limb pain means pain which is originating from a particular organ which has been removed. And also sometimes in cancer patients who are receiving chemotherapy or radiation therapy, they have severe pain in the oral mucosa, which is called mucositic pain. Types of cancer pain can be acute as well as chronic. Acute pain means the pain which occurs due to injury or due to surgery, and acute pain can be managed with various medications. Chronic pain occurs due to changes in the nerve. The nerve changes can be due to like tumor which is compressing the nerves, or due to chemicals which are released from the tumor. Chronic pain occurs because of nerve damage. It can occur due to the tumor which is compressing nerves, or it can occur due to various chemical mediators released from the tumor, or it can also occur from the treatments like chemotherapy and radiation therapy. There are various medications. Some comes under the narcotic groups like morphine, fentanyl, etc. And there are various patches also available which can be pasted over the skin surface like the anterior chest or posterior chest. It contains drugs and it continuously releases the drug into our body. There are some advanced procedure like intrathecal pump implantation, which we do frequently in our center. Intrathecal pump is a device which continuously deliver drugs into the intrathecal space. This pump is implanted in our body, like in our anterior abdominal wall. We make a pocket and we implant the pump, and one catheter is connected to the pump, and this catheter continuously delivers drug into the intrathecal space.
Pain being such an undertreated condition drove me to choose this field. Delhi Pain Management Center is a one-stop solution for various dimensions associated with pain, whether pharmacological, social or psychological.
At Delhi Pain Management Center, our vision is to create a pain-free India. And the way we are doing it is by providing pain treatment services which are effective yet economical. Our world-class centers are equipped with best-in-class technology, equipment and infrastructure. All our doctors have been trained with the most rigorous training and certification systems for over 1 year in pain management. We make sure that the most important part of this treatment process is you, the patient. From the point of time that the patient enters, the time that the patient registers, till the time a procedure is carried out and the patient exits, we make sure that the patient is very comfortable and feels at home. Our pain management centers try to bring different multimodal specialities together. Anesthesiologist, neurologist, orthopedicians, rehabilitation specialist, physical specialist, pharmacist, all coming together to take care of you.
In the last 12 years, ever since we started the Delhi Pain Management Center, we have steadily grown in size as well as in the number of services which we are providing for managing chronic pain conditions. And I can proudly say that today we are the India's leading chain of pain hospitals which are providing comprehensive pain care facilities for the population suffering from acute and chronic pain. Today, I can proudly say that Delhi Pain Management Center is the largest chain of pain hospitals existing in our country, providing services to millions of patients who are suffering from chronic pain. Pain medicine is relatively a new branch of medicine and has provided ray of hope to lots of patients who are suffering from untreatable and intractable chronic pain. At Delhi Pain Management Centers, we are providing interventions and medications as per international standards. All our drugs and medications are approved drugs and very safe or absolutely safe drugs. The protocols which we use for interventions for managing chronic pain conditions are all evidence-based protocols and have been laid down by using double-blind trials or controlled randomized trials, and they have been set up as safe protocols which are used for managing chronic pain conditions. And through a comprehensive approach where we use rehabilitation, where we use lifestyle modification, use counseling, medications, non-surgical interventions, we have been able to provide comprehensive pain relief to a number of patients who were earlier suffering from this intractable or chronic pain. All our doctors who are working at the Delhi Pain Management Centers have been trained by the best faculties in the world and are fully equipped to perform advanced or simple interventional procedures for the care of patients who are suffering from chronic pain.